Hi, good afternoon. We are going to start with criteria 11 and work through criteria 11 through 25 today for your physical assessment. We're going to start with the chest. We stopped at the gag reflex for last week, and this week we're going to start at the chest and work our way down to the extremities and be done. Okay, for your landmarks on the chest, for your anterior and exterior, for your 5 placements on the front on each side, which would equal 10, and on the posterior, you're going to be looking at 9 places on each side, which would be equal to 18 spots on the back, on the right, and on the left. You also want to make sure that prior to either starting your assessment on auscultating your lung sounds that you are looking visually at the chest. We want to look for if it is barreling, their effort of breathing. So I'm going to have you take a deep breath, Miss Smith. Okay, Miss Smith is breathing equally. Her chest is rising and falling equally, so it's symmetrical is what I would identify it as. And I would also walk around and see how that posterior, how she is doing as well. You might be able to visualize this looking at the side, but for my purposes of recording this, I'm walking around. But when you're checking off, you may be able to actually see it by having them take a deep breath and just looking from the side, okay? So can you take another deep breath for me? Okay, her chest is rising and falling, and she is breathing symmetrical when she takes that deep breath, and it is effortless. So I would report this as she is breathing anterior and posterior symmetrically with non-labored breathing, visually noted. So now we're going to auscultate. I'm going to start at the clavicular, and you can either start on the right side or the left side. Remember, we're going to go in a stair-step manner, and this is so we can compare our sides from one side to the other. So starting at the clavicular, we're going to follow the top of the apex. Take a deep breath, please. This would be 2, 2, 3, 3, 4, 4, 5, and 5. I would note that she anteriorly in all lung fields, she is with non-adventitious lung sounds. Let me just get her positioned for you. So posteriorly, we are going to find the cervical, and we're going to go down to the cervical 7, which that typically in a person, you can feel that. And it's usually about right there. We're going to follow the rib cage with not getting on the bones or the ribs. So we'll go in between. So we'll start at about the second rib from on the apex side below, right at the cervical 7. So it's kind of high up. Take a deep breath, please. 1, 2, 3, 4, 5, 6, 7. And here you can either go back to the other side and say 7 on your other side. What I always do is I stop here at 7. I go to 8 and then 9. Then back over here to 7, 8, and 9. Okay? So they have a smaller torso than your actual person will have, okay? Just remember you want to follow the part of the lung right through here and stay off of the bony prominences of the rib cage. Now just give me a few minutes to get her positioned back in the bed. Okay, so next I am going to listen to her heart sounds. I have posted a picture for your heart sounds online, so you'll be able to see that for your placement, and it'll help you a little bit. Okay, so we're going to start with the patients. We're going to start on the right side, and we're going to listen to the aorta, and we're going to find the patient's right sternal border. The sternal border runs right down the center, so we'll find her right side, and we're going to look for the aortic, which is going to be on the second intercostal space. And you would listen. Then we are going to move to the pulmonic, and that is going to be on the left sternal border side, and it's going to be straight across because it too is going to be on the second intercostal space. So you're just going to slide right across. You would listen to that. Then you're just going to go right down like a stairs, and it's going to be a third intercostal space. And here on this left sternal border, we are going to be identifying at the third sternal border Erb's point. So you're just going to slide down there. Then you're going to look for the tricuspid, and it's going to be just another stair step down, and it's going to be at the fourth intercostal space. So it's straight down. I'm right there in the center. Now for a female, if they're big busted, you might have to move their breast tissue or have them displace it for you when you're at the fourth intercostal space. Then we are going to listen for the apical pulse, which is going to be your mid-clavicular at the fifth intercostal space. So you're going to look at the clavicular, the clavicle bone, the center of it, straight down. Female, you're going to have to displace that tissue. This is where you're going to listen for 1 full minute. And then you're going to identify the rate, and I'm going to say that hers is 82, regular rhythm. I identified S1 and S2 upon auscultating the heart tones and the heart sounds. Okay. So now we are going to move on to her So let's do her upper extremities. If you want to at this time, you can have them sit down and, do abdomen and then both extremities. However you choose to do it from here is fine. So I want my patient, I'm going to ask her to hold her hands straight out. When she holds her hands straight out, I will be looking for length. I will identify that the patient has the same length. I would also identify size by holding her arm and making sure that both arms are close to the same size, that one arm's not a whole lot bigger than the other. Now, granted, some people may have a little bit bigger extremity or even in length a little bit. We're going to identify hers as symmetrical bilaterally, and we're going to identify her arms in length bilaterally the same. Now I'm going to have Miss Smith to do range of motion on her elbow, and I'm going to palpate that as she is moving her arm. I identify no crepitus sounds when she is performing flexion and extension in the elbow. And Miss Smith, are you in any pain? Does it hurt, or do you have any tenderness when I touch around the elbow? Miss Smith identifies that she has no pain. Now I'm going to have her rotate her wrist, and I'm going to feel for crepitus. Any pain noted, any tenderness noted when I palpate and you have range of motion in your wrist. And she can go both directions without any pain, any tenderness noted. I would do this bilaterally. I'm going to have her shrug her shoulder like this. And when she does this, I'm going to palpate. I feel no crepitus. I hear no snapping. Do you have any pain or tenderness when you rotate your shoulder front and back? She can do range of motion, rotating shoulder and shrugging shoulders without any pain or tenderness. No crepitus heard, no crepitus noted on palpation. I would do this bilaterally as well. Right now, I am going to have her do some fine motor skills. And fine motor skills is I would ask her to touch her finger, her thumb to each finger. I would have her open and spread out her hands and close her hands and make a fist. And if she can do this, I would identify her as having fine motor skills intact. Now we're going to identify her strength of her extremities, and I'm going to have her push against my hand, and I'm going to be pushing against hers, and I want to be able to feel her strength. Miss Smith, can you push against my hand, please, when I push against yours? I would grade this at 5, which would be normal strength, and I would identify this on both sides. Now, can you squeeze my hand? And here I usually would do both just to get the ideal of strength in both hands, okay? She has a good squeeze. I would identify that as well as a grade 5. Now I want to identify her pulses. So I'm going to identify her radial and her brachial pulses, and I'm going to locate her brachial pulse first, and you will find it on the thumb side, and you're gently going to palpate until you feel a pulse. I identified her rate earlier at 82 when we took her blood pressure and her vital signs, but I would grade her pulse at a 2+. I'm going to locate her brachial pulse, which is going to be in that indention of the elbow, right below her biceps. I would palpate that. You might have to press a little firmer for your brachial. If you do not feel it upon palpation, you may have to move your fingers a little bit, either direction. I would identify her brachial pulse as palpable at a 2+. And I would identify both bilaterally on each arm. Okay, Ms. Smith, we are now going to have you lay down, and I'm going to look at your abdomen. We're almost done. God love her, we said she's got strength, but she doesn't. All right, now I'm going to lay you down a little bit. Comfortable. Okay, at this point you can look at the abdomen for your appearance, or you can do that after you auscultate the lung sounds. You just want to remember that you don't want to palpate prior to listening. So whatever makes you more comfortable to where you remember that. So I'm going to listen first. Remember, we're going to start on the right side. We're going to identify her umbilicus, which I've identified it right there, is where I feel it. And I'm going to slide down to the right lower quadrant. We would listen for a full 5 minutes if we did not identify any gurgling or any activity in the bowel sounds. Keeping my landmark there. So I went from the right lower to the right upper. Then I will slide over to the left upper. And to the left lower. I identified that Ms. Smith had normal active bowel sounds. Again, you want to say that you would listen for a full 5 minutes if you did not hear any activity and you thought they were hypoactive. You would have to listen for a full 5 minutes in each quadrant to be able to say that they are hypoactive. So be sure that you identify that in your assessment, okay? That you have listened for 5 minutes if you did not hear anything, for a full 5 minutes in each quadrant, okay? That's very important. Okay, so now I'm going to be looking at her abdomen, and I'm going to be looking how it too rises and falls, making sure I do not see any pulsations. And I do not see any pulsations. It looks pretty symmetric. I'm going to touch your area of your belly, and you tell me if you feel any pain. And you're going to just gently palpate. Ms. Smith, do you have any pain when I touch you in these areas? She identifies that she has no pain, no pressure. I feel no masses, no nodules when I palpate. So I would identify her abdominal assessment as bowel sounds active, normal in all 4 quadrants, and she has no pain or no identifying visually of any pulsations or upon palpation, any type of masses or knots or herniations that is identified at this time. Ms. Smith, can you tell me your last bowel movement? Oh, great. You've had one today. Any trouble having a bowel movement or any changes that you've noticed? You have not? That's good. What about when you go to the bathroom and you urinate? Do you have any burning? Any pressure feeling or feeling like you're not getting it all out good? Good. So you feel like you're going normal, no smell, no darkness or no change in color. Great. So she has identified that she is having normal bowel movements and she's having no problems with that, as well as no problems with urination. Now we're going to move to the lower extremities. I'm going to raise you back up. Now I'm going to have her bend her knees. We'll have her bend her knee. And as she's bending, I think I got you up a little too high. There we go. And upon bending her knee, I feel no crepitus. I hear no crepitus. Do you have any pain? Just a little bit of tenderness? Okay. She has a little bit of tenderness in her left knee from an old injury. And I would do this bilaterally. Now I'm going to check your range of motion in your ankles. Can you move them forward and press them back? Any problems with that? And if I was helping her do this and feeling, I would have gloves on since I'm touching her bottom of her foot, but I'm doing this for checkup purposes to show you. So she's supposed to be doing this herself. Same way with her range of motion, I would have her rotate her ankle both ways, and I would be feeling for any crepitus at that ankle area as she rotates it. And I hear no crepitus. Actually, I do hear some crepitus. And I feel just a little bit of crepitus. And I would do this bilaterally. Now, Ms. Smith, I am going to put some gloves on, and I'm going to look at the bottoms of your feet and your toes. Are you ticklish on the bottoms of your feet? Okay, most people are, so I'll try to be gentle and give you some warning when I get ready to touch you, okay? So I'm just going to wash my hands before I put my gloves on. Okay, her toenails are all intact. They are pink and translucent in color. She has no ingrown toenails that I've identified, no bunions or no corns that I can identify. In between her toes, I see no lesions, no cuts, no abrasions, and again, no broken toenails. Assessing the bottoms of her feet, I see no corns, I see no cuts and no abrasions. I would identify her foot within normal limits. It's warm to touch. I see no edema. It's pink in color. Looks like she's got good circulation, so let's see how good her circulation is by palpating her pulses. And I'm going to start with her dorsalis pedis, and that is going to be when you find your big toe and you just slide down laterally, parallel, gently press. Again, if you do not find it or feel it, you might have to press a little bit more firmer or let up a little bit or move a little bit in either direction. I would grade this as a grade 2+. Then I would do that bilaterally as well and compare. You can do this at the same time. Now I'm going to find her posterior tibial, and you're going to find the malleolus, and that's that big bone, and you find that indention. So you find her malleolus right there, medial malleolus, and that's that bone. Find that indention that we all have, and if you feel your foot, you'll find that. It's usually right by close to that Achilles tendon. You have to press a little firmer usually to find that. You may have to move around a little bit. And I'm going to identify her as a 2+. All right. and I would do that bilaterally as well. If I couldn't identify a pulse and I thought there might be some complications, I would at this time bring in a Doppler and Doppler just to make sure that she has good circulation and that it was just me not being able to find it, or that she just, they're real tiny, okay? So now I'm going to take off my gloves and discard them. And I'm going to wash my hands. And Ms. Smith, do you have any questions? This completes my physical assessment. I found everything to be within normal limits. If you don't have any questions, then I'll let you get dressed. And while you get dressed, I will go document all my findings of my physical assessment. And thank you so much for being a patient and being a good patient and didn't talk back. If you have any questions, just let us know. Just remember to continue to say bilaterally, and remember to identify your cranial nerves, identify your grades of your pulses and your rate of your muscle strength as we discussed, and tell us where you are on your heart. That's very important, as we talked about. Identifying your placement, identifying where you start of your lung sounds, and you're welcome to count out loud for that if you need to. Don't do this when you're doing lung sounds. The patient, remember, we don't have to just continue to take big breaths. Have them take a couple and then just breathe, tell them to breathe normally. But we don't want to see you just, okay? You need to go slow, take your time a little bit, so we see that you know where your placement is, and that we know, that you're where you need to be, okay? Or we'll make you slow down and do it again, which could take some time, all right? All right, thank you very much.